Good afternoon. I'm Robert Hadlock. Britt has the day off. Well, today's the last day of National Nurses Week. The focus is on nurses, their hard job, and challenges they face. It comes as more than 100,000 nurses left their job last year alone. Our Sally Hernandez sat down with a nurse who is helping a national advocacy group get nurses the care that they need before they can care for anyone else.
As you mentioned, a longtime nurse, you see a lot of bad things behind the scenes. How important is it to reach out for help?
It's really important. I think we've had a nursing shortage in this country for a long time, but what we're seeing in 2021, we had 100,000 nurse RNs leave the profession. And if normally when we look at that data, it's more of the people who are ready to retire that have left. In this data, what was interesting and disturbing is that the largest percentage of nurses that left were under the age of 35.
Tell me a little bit more about that study that you were just talking about. So nurses are retiring before they're 35 years old. And you think it has a lot to do with the stress that they're under?
I don't know if they're retiring, but they're leaving the profession. And I think when we're looking at it, it's burnout and fatigue are the most commonly cited. There's also a fair bit of violence at the bedside where nurses are dealing with abuse, and both physical and mental abuse from patients and family members. And I think that is just when you find yourself in a stressful situation, you take a look at, is this a safe place for me to work? Is this a safe environment for me? What we really need to be doing is making sure that the employers and policymakers and schools of nursing are supporting nurses every day in the job that they're doing.
What is one of the biggest ways that they can do that?
For employers, it's taking a look at, how do we make it easy for nurses to say, hey, I'm not all right, I need some help? The other thing I would say employers can do is take a look at staffing ratios. Make sure that they're looking at the illness levels and the complexity of patients, and that they're not putting nurses in unsafe working conditions by having them care for too many sick patients.
I can't imagine just the magnitude of that, especially if you need a day to just rest mentally, but you can't because there's nobody to cover your shift because of a nursing shortage.
That's right. If you don't have enough nurses, you can't take that time for personal care that you need.
Michelle, such great information. Thank you so much for all you do.